Welcome to the Former Insider's Look at K-12 Education with Cindy. This is Episode 8 entitled, Are Community Schools the Backdoor to Community Health? We will be discussing community schools and school-based health centers, and they're both names for pretty much the same thing. Please take note of all the power and money behind these programs. You will hear these names in this video. The U.S. Department of Health and Human Services, the CDC, Melinda Gates and Mackenzie Scott, who's the ex-wife of Jeff Bezos and also the wealthiest woman in the U.S., Big Pharma, Walgreens, Planned Parenthood, and the National Teachers Union, American Federation of Teachers. And they're only the tip of the iceberg. There are many other powerful people and organizations behind these community schools. Now, I recently attended a webinar on school-based health alliances, community schools. This webinar was supported by the U.S. Department of Health and Human Services. A spokesperson from a model health alliance in Georgia led the seminar. Now, these health alliances are part of the CDC's socialistic whole school, whole community, whole child, otherwise known as WSCC model that I've reported on before. And where is the CDC location? That's right, Georgia, where the Model Health Alliance from the webinar was located. I found out more information regarding what these clinics will look like and how they may already look in most schools around the country. In fact, they told us at the webinar that 49 states already have these alliances. That was shocking to me. I'm still not sure which state does not have it. Please remember that you most likely have these centers in your state and your district without even knowing it. And they're probably starting out small, usually with mental health therapists from outside agencies, but the aim is for them to be fully functioning health centers eventually. There are already a few states that have fully functioning centers, such as California and Washington State, and the parent groups from those states are ringing alarm bells like crazy, and many people are not listening to them. Now, let's be clear that I'm calling out both Democrats and Republicans on these school-based clinics, because both sides are letting them into the schools. And when I ask almost anyone involved in politics and education about these clinics, I'm usually met with a very curious silence. Since I live in Arizona, I've posted on X a long list of Arizona school districts that already have these school-based center contracts with a number of agencies such as Southwest Behavioral Health and others. Now, even school board members don't seem to know about these contracts. They're not simple partnerships like I've been told, in which a school counselor gives families a list of referrals for outside therapy. Everyone does that, and you don't need a contract or partnership for it. No, these are the school-based centers that are part of the socialist WSCC model. I get calls all the time asking me to interview for school-based therapist positions. Now, in a job ad for one of these positions, this statement surprisingly appeared in the description. School-based counselors also become familiar and connect families with our mobile team, which consists of a mobile unit, nurse practitioners, medical assistants, and mobile care coordinators that visit school campuses. That was surprising, and this signifies that Arizona, like other states, is moving toward the full-service, school-based health alliance. I posted this on X, and so many people reacted and were shocked about it because they realize, yep, that's where it's going. Now, should we follow the money? For instance, Melinda Gates and Mackenzie Scott contribute $25 million to these clinics. Like I mentioned earlier, Mackenzie Scott is the wealthiest woman in the U.S. and formerly married to Jeff Bezos. Big Pharma and Walgreens are also involved through STD testing, which stands for sexually transmitted diseases, and the HPV vaccine, which I'll explain a little later in the video. But first, I'd like to share some highlights from this webinar that I attended. These clinics are certainly a one-stop shop for all of your children's health needs. In fact, I'm starting to wonder if it's the government's way of sneaking in socialized medicine through the schools, because after all, every student will have access to these clinics. Also, they mention that adults who work in the schools can have access to them too. I've read articles that say all community residents, including adults, will be able to use these clinics. Parents sign only one consent form at the beginning of the year, and that gives these centers permission to administer any health services to their children for the rest of the school year. I haven't found one of these consent forms yet, but I have reason to believe they may be disguised within other forms, from what I could find when searching district websites. This is the key point to remember. You only sign one form, and that gives these centers permission to do anything health-related to your child all year. I've heard and read that that's what's happening in various states, and that's the problem, because parents are not aware they're signing permission for all health services and will not necessarily be notified when their children are actually receiving these services. We've heard horror stories around the country of how some students are being prescribed trans hormones, psychiatric drugs, and vaccinations without their parents' knowledge. And don't count on your children to tell you anything, because let's say they get vaccinated, for instance, and they just might think nothing of it, because after all, we've been undergoing school-based vision and hearing screening for a long time now, and so they've been accustomed to medical services in their schools. All these fully serviced school-based health centers have well child exams, immunizations, dental and optometry services, and of course, behavioral health services too. In fact, the webinar speakers made a big deal out of announcing that behavioral health services continue throughout the summer. In the webinar, there was a big curious emphasis on STD testing. In fact, a lot of time was spent on that topic, and I wasn't sure why, until I did some research and found that there are reproductive health services at these clinics. I'm sure that doesn't surprise you. There's gynecological exams, gender-affirming care, of course, pregnancy testing, and contraception. I've heard rumors of abortions and other things. The fact that Planned Parenthood and the National Teachers Union, American Federation of Teachers, support these centers tells you quite a lot. I recently also found out that Big Pharma and Walgreens are involved. Big Pharma, via Merck, has been administering the controversial vaccine for HPV. That stands for human papillomavirus, without parental knowledge. Now, this virus, HPV, can cause some STDs. Many parents are still against this vaccine. I refuse to give it to my daughters. My thoughts are that STD testing is possibly being done and emphasized to convince the public that the HPV vaccine is necessary, though parents aren't being told that their girls are even getting this vaccine. Also, for those students who are at schools without these centers, there will be transportation during the school day to schools with these centers. Please note that this would happen during the day when students should be learning academics. Telehealth will also be a service offered, especially for behavioral health and primary care, and particularly for those who do not have centers at their schools. These centers have even begun creating contracts with pediatricians so that children can be seen at the clinic and then told to follow up with their pediatrician. This was told to me by the webinar. The webinar host emphasized how to obtain and retain buy-in for creation of these centers. He said that the superintendent, principal, and assistant principal must be contacted and met with often. He said people running these centers should attend faculty and staff meetings and receive school board updates. They also talked a lot about tracking data, which should concern everyone. I did happen to hear also that the federal school safety grant funds are drying up. These are the ESSER funds given out for COVID relief and used for hiring counselors and police officers in schools. ESSER means Elementary and Secondary School Emergency Relief Fund. So schools will stop hiring counselors for crisis mental health counseling like they had been doing for the past few years. Every year that I was a school counselor, I worked under those grants. However, I fear that these school-based health centers will be taking over instead. Like I said earlier, I receive calls almost daily asking me to work as a school-based health therapist, and I always refuse. I released an earlier video explaining my investigation into the therapist's role in these clinics. What I found out was very disturbing. They would not be bound by the laws governing the schools because their actual employer would be their community health agencies, not the schools. In other words, if there's a Parents' Bill of Rights like in Arizona, the therapist would not have to follow it and so would not be required to tell parents if their child is, say, transgender or using drugs, for instance. They'll follow their therapist's confidentiality rules instead, which means not necessarily telling parents about things like transgenderism or drug use or other things. Finally, the question is one that I've asked residents on X, Arizona residents on X. Now that you know that your school district probably has these community school-based centers, what are you going to do about it? Well, you can start by telling your elected school board members that you don't want these centers. However, keep in mind that this will be a very challenging battle because there's a lot of power and money involved. But we all have to start doing something. Don't you agree? Thanks for listening, and take care until next time.